Well, if doctors were more sensitive like you, how would that change healthcare?
It would change it tremendously because you heal with it. You heal people with it. We, in Western medicine, heal people with a test and a pill. We give a diagnosis. Everyone's ADHD, oppositional defiant disorder, they're OCD, they're this, they're that, and they're bragging about it. They're saying, well, you know, I have this, I see my shrink, and I've been going there for 20 years, and I'm taking this pill and that pill, and I have all this pain, I'm on OxyContin. Well, that's the problem.
That is the problem. So they're perpetuating the problem.
Yes, they're perpetuating the problem. They don't know what to do with you. So the insurance company wants a title, they'll give you a title, and then they'll give you a pill, and then they want you to beat it, and they'll see you in 4 weeks, or 6 weeks, or 8 weeks.
That is what's destroying people, and,
Right.
and patients go along with it, and doctors go along with
Right.
it, and there's this kind of unconscious syndrome.
So healthcare reform should begin with sensitivity reform. Should begin with changing this and saying, you are not allowed to give a diagnosis unless it's real.
What do you mean by real?
Well, what I'm saying is too many people carry too many diagnoses. Everyone has one. And I mean, sure, some people do have those entities, but everybody has one.
Well, how do we get beyond? You have to go to medical schools, right? And start there.
That's where you have to start.
You do.
And you have to start by the type of people that are allowed in medical schools. They should take a sensitivity test, not a cutthroat test because you had the best grades in town.
Oh.
It should be balanced. The upper chakras, 5, 6, and 7, spirituality and love, should be balanced with the lower chakras, 1, 2, and 3, survival.
Wow.
Through the heart. So maybe they have to give a little test. Maybe they should take more students with B pluses and not A pluses.
Because the people who weren't studying so hard maybe had more time for compassion.
Right. And maybe they got involved in life, and maybe they had relationships.
That is so good. That is so important.
And how much community service they do in medical school.
Yes. What, can this change?
Sure it can. All they have to do is make a decision. Just like going from fear to love. Let's make a decision. What do you want your medical student to look like?
Wow.
In the 21st century.
But the problem is the people who control the medical schools and the hospitals, and it's...
We're the same people who came through the system, like myself.
Yeah, right.
You know, they came through this brutal system.
So people like you need to go in, stand up, and say...
Think about this.
Yeah. So you should be giving your talks...
to medical students.
You should be.
Yes, I would love that.
I mean...
Or ER doctors.
That would be so important. But there's no precedent, there's no paradigm to...
None. This is totally revolutionary.
Yeah, we have to start a way where this sensitivity training, like bedside manners, you know.
It's not just being polite, it's having feeling.
Yeah.
Forget the politeness. Anyone could say, thank you, goodbye, but do you mean it? It's like, you know, there's a wonderful psychiatrist, and I forget his name now, but his field of thought has just been approved about 10 years ago to be acceptable. And it's called transactional analysis.
All right.
But it says you meet someone, you go to work every day and you see someone, you go, good morning, how are you? Like you really care. And they say how nice you are. Boy, what a nice person. He says that to me every day. But don't ever stop and say, you know, good morning, but I'm feeling terrible. Do you have a moment to talk to me? Oh my God, I got to rush. You're kidding me. You really want to talk? I just wanted to look good.
Well, then it's a symptom of the whole culture. You can't just say it's the doctors.
No,
but
it's the whole culture. It's not just medicine. It's what Americans or Westerners demand. They demand this. They demand it. This is the service they want. They want McDonald's.
Wow. No, I think you're hitting at the core of a deep issue in the culture, the issue of feeling and sensitivity. And that is what I feel is really key in shifting people to, well, let's call it new realities, the understanding of what am I feeling? What's the feeling? Because feeling is the core to everything we are, is the feeling. And then it comes thought, and then intellectualization, and then numbness. But it's the feeling. And if you can get people back there, and you and everyone else who I like to have on this program, then we can start a real revolution.
Oh, absolutely.
Because it's the revolution of who we are.
Yeah. By changing one person at a time.
Yeah. It's such a huge thing. But thank you. Thank you again.
Thank you for having me.
No, I really appreciate that.